Good?
Okay, we're good.
Okay, perfect. And with that, we're going to go ahead and start. So just one more time, welcome everybody. Thank you for joining us this evening. Want to just start. As always, when we begin together, I always just want to take a moment to recognize where we are. Because I don't think it would be fair for me or any of us to act like everything's wonderful and we're in normal times, right? So I want to just stop for a moment and recognize that once again, we have changes. And once again, we have some challenges. One thing we know is that things continue to change in this journey. And they probably will change again. And so I want to just thank everybody for your patience and cooperation as we navigate all of the changes and all of the challenges. And I know you know this, but I just want to say it. All of the things that we do, all of our decisions, all of the protocols, procedures, everything is under the guidance and the direction of the New York City Department of Education. I often wish I could make some of my own decisions as with my administrative team, but we do have to function under the guidance of NYC DOE, which I know everybody knows. So the latest changes are bringing us back to the school building, right? So we always have to think about the good in all of this, the silver lining. We have missed having children in the building. So Sunday morning, as I was sending out my weekly email to my staff, literally as I was sending it out, some of my staff members started emailing me, "Are you watching the news?" And that's how this information usually rolls out. Rolls out on the news first, and then we find out about it. So spent a bit of time Sunday looking through all of the guidance to make sense of it and get it out to all of you. So who is eligible to return to school on December 7th, which is Monday? And the answer to that is only students in grades 3K through 5. And these are students who are already in our blended learning. This includes any students who just completed or any families who just completed the opt-in for blended learning in November. Okay, so anybody who is already in blended learning in 3K, pre-K, kindergarten, grades 1 through 5 is eligible to return on Monday. Of course, one thing we always have to watch are the state designated red and orange zip codes. And when this PowerPoint is posted on the website, you can look at that to see where those zip codes are. Always hoping that our zip code stays out of there. But starting Monday, students in grade 3 through 5 are eligible to return to school. What does this mean for our middle school students? There was definitely some confusion, but middle school students right now are not eligible to return. They are to remain in full remote instruction until further notice. And even though we're a pre-K to 8 building, we have to abide by that rule. So middle school students will stay on full remote instruction until further notice. What I've heard is that it will probably be at least until after the winter break. And again, this is not a school-based decision. This is via the mayor and the chancellor. Okay, in order to return to the building, right? In order to return, what has to happen? What are the criteria for students, first of all? There is going to be weekly testing now in schools, COVID testing. Before the closure, we were getting tested once a month. Now, what they're explaining to us is we'll be having testing once a week. All schools will have 20% of their students in grades 1 through 12 only, and staff randomly tested on a weekly basis. Okay, I want to be very clear that students in our school, we don't have 3K, but in pre-K and kindergarten, those students will not be tested. They are not eligible for testing. So if you are the parent of a pre-K or a kindergarten student, there's no testing. Okay, so testing begins in grade 1 and for us goes up through grade 8. But right now we're talking about grades 1 through 5 who are returning on Monday. All students who return from grade 1 and higher are required to provide consent for testing by the first scheduled in-person learning day, right? So I believe Monday is an A day. So if your student is coming on the A day, they have to have the consent by that day. If they're coming the next day, they have the consent the next day. And I'm going to continue explaining that. I also want to just share with you that all staff in the building are also required to provide consent by their first day in the building. So that means every staff member who's working out of the school building will also provide consent and be eligible for consent. So when we think about that 20% who would be tested weekly, it includes staff and students. The one thing that has not been made crystal clear to principals yet, I asked today, was whether it's 20% of our entire student body, 20% of 640, or 20% of who's in the building that day, because that's a very different number. That is something I'm waiting for clarification on, but I will share that as soon as I have it. But the 20% is comprised of students and staff. And our staff members have been very willing to be tested, so that can take up a good portion of the testing on any given day. I know that there's been a lot of anxiety, fear, worry about having your child tested in school. And so what I want to do right now is just talk to you. Yes, I'm your principal, but I'm also a mom, right? And so I'm talking to you as a mom and a principal, because I want you to understand what the testing looks like and feels like in a school building, right? So, and the point here is not to convince anybody to consent for testing. That is your decision. But I think sometimes fear or worry comes from the unknown. So although you can't be in the building with us during testing, I'm going to do my best to let you know what it looks like and feels like, in hopes to, kind of de-escalate some of your worry and fear. So on a day of testing, and this is based on how it's happened in our building, the Department of Health staff comes into the building. Our staff is present with the students every single step of the way. When we had testing in November, we tested 70 people in about an hour and a half. It goes very smoothly and very quickly. On that day, we tested 40 staff and 30 students. Ms. Falchetti, Mr. Hoffman, Nurse Katie, and I oversaw every moment of the actual testing. We had a couple of other staff members, our psychologist, Ms. Sullivan, our social worker, Ms. Ruhan, our family worker, Ms. Mead. They were running back and forth to classrooms to bring students down in a very safe and calm manner, but we never left their side. And I want you to understand that they're never alone. They're never by themselves. They're never in an office with a person they don't know. The day we did testing, we did it in our gymnasium. And so the students were brought in groups. We started with our middle school students on that day, and then we went down to our 5th grade and 4th grade. The students were brought in groups of about 8 to 10 at a time. They remained together, the students. And in the gymnasium, we had 3 tables set up. One table was a check-in table, right? And that was the check-in station where the child's name was entered and we had our consent forms with us, so we knew every child getting tested that day had consent. I stayed at that table. So every student who came to that table, I would say, hi, Catherine, how are you doing today? Do you know what's happening? And everybody said yes. We put their name in the system. The gentleman who was at that table from Department of Health was very funny. He made the kids feel very much at ease. And when they were ready, when they were checked in, they would go to one of the testing stations. There were 3 of them, all in the gym. I could see them. So depending on what testing station was open, Ms. Falchetti was at one, Mr. Hoffman was at another, and Nurse Katie was at the 3rd. So they'd kind of just hold their hand up, we're ready, and I would send a child down. And again, eyes on your children at all times. They were never alone, and this is how we plan to hold testing in the future. So they were always supervised. Students were never, ever without an administrator or a nurse. When the students got to down to the testing table, oftentimes, if there was a staff member in the gym at the time who was there for testing, we would let them watch a staff member test first so that the children could see. It was very easy and very quick. And I myself was tested. It's almost like a little tickle right inside your nose. So there were lots of giggles, and we just did everything we could, and we will do that continually to make the children feel calm. The swab is the size of a Q-tip. It's not the very long swab that you've seen or you may have experienced where it goes way deep into the nasal cavity. It's a very small Q-tip, and it stays right at the base of your nose. And we have a short video to show you in a second. And once again, we were with the students at all times. So I'm hoping to just make parents, if you're aware of what it looks like in school, it might take a little bit of the worry away from you. I assure you that students were comfortable the whole time. Like I said, most students watched a staff member get tested first, just so they could see it was very quick and easy. All students left the testing feeling comfortable and happy. I will tell you, on the day of our testing, we had one first grader who was a little nervous. And so we brought him back to class. We did not test him. And again, going forward with testing, if any student showed us that they were nervous or upset, you know, I hope you trust in us that we would do what we would do for our own children, right? And if that was the case, we would not proceed. I'm sharing just a very quick email that I got the night after the testing was done. Actually, it was the next day. At the bottom of this slide, where a parent wrote to me in an email, "Hello, Mrs. Welsom. My husband and I are sending a thank you to you and your faculty who helped with the Q-tip test, as Catherine called it. She was quite proud of herself. We received her results, which were negative. Thank you for ensuring she was comfortable." So that was just one little email I got the next day from a parent whose child went home and told mom and dad about the testing in a positive way. There was no fear, and that was a quick email that I got. So I wanted, as much as I can, just calm any worry about the testing. I do understand, as a mother, especially of young children, who you've been with your child every time they've been to the pediatrician, every time they've gotten an immunization, every time they've had any kind of doctor visit, you've been there. So this does not always feel comfortable to say this is going to happen without you. But I hope by explaining what it looks like and what it feels like, and reiterating once again that they never leave our sides, and that it went very, very smoothly, and it was something that I, after seeing it as a mother, would be very comfortable with. But again, it is a decision you will have to make. Okay, I just want to share this quick video of what it actually looks like, the testing. If I can't get this link, Mr. Hoffman is going to bring it up on his screen, but it looks like it's working. And it's literally like a minute long. I see Mr. Hoffman. Just give me a thumbs up if you can see. Or Ms. Falchetti, can you see where the video is?
I only see the link. I don't see it pulled up yet.
Okay, tell me. Oh, hold on a second. Let me stop sharing and share in another way. Just give me 1 second. I was sharing. Okay, here we go. Okay, can you see it now?
Yes.
Okay, perfect. All right, this is a very quick video of what the testing actually looks like. There have been a couple changes in policy since this video was made, and I'll just explain that in 1 second.
You know what we're doing today?
Yeah, COVID testings.
Yeah, so I wanted to show you what's in the test. Hi, I'm Dr. Katie Punica-Worms, a pediatrician with New York City Health and Hospitals. As a doctor for our city's children, I know that keeping our kids healthy means keeping our schools safe from COVID-19. That's why, together with our partners at the New York City Health Department, the New York City Department of Education, and the New York City Test and Trace Corps, we're bringing COVID-19 testing to schools to keep our students safe and our classrooms open. Starting this month, we will test a random sample of staff and students from first graders all the way to 12th graders in school 1 day a month. The COVID-19 test is free, safe, and easy, and results are returned within 48 hours. We will only test students whose parents or legal guardians have given consent. So reminder to all families, sign and return your consent form as soon as possible. Let's work together to keep our school communities healthy. For more information, visit schools.nyc.gov/COVID testing.
Okay, let me just get back to my PowerPoint. Okay, so the one thing I do want to bring out quickly is that since that video was created, the testing is now weekly. And of course, we are still only testing students with who've given consent. But again, the change now is that DOE is requiring consent. But I hope by seeing that video, and that is exactly how it looked in our gym. The children sit down, it's a very small Q-tip, and it's done very, very quickly. Like I said, we tested about 70 people in 90 minutes, okay? Mr. Hoffman, I'm gonna stop for a moment because I think you indicated that there are a couple of questions in the chat.
Yes, there are a few questions. One is, are the A, B, and C groups changing, or are we still following the same model?
Okay, so that's regarding our cohorts, and I'm going to talk a little bit about that toward the end. So just hold off on that. Are there any questions just about the testing right now?
Sure. What if a child freaks out or refuses in the moment, and will they be forced to have the test taken?
No, I think I covered that a little bit, but let me be specific. If a child is like I said, the day we did testing in November, we did have one student nervous, and all I mean is nervous. There was no freaking out, no crying, anything. He was in the chair and he looked nervous. And when we spoke to him, we said, "Are you nervous?" And he said yes. And he just didn't look like he wanted to be there. And so we brought him back to class. So nobody will ever be forced physically, to be tested for sure. If a child is randomly selected time and again for testing, that's something, and they don't want to, and they're showing us they don't want to, well, those are conversations we'll have with a caregiver specifically. But again, we would never do anything to harm a child like that.
Okay. If a member of the school community tests positive, are they required to inform the school?
If it's a member of the school community, meaning a staff member or a student, we are certainly asking you to let us know so that we can report it to DOE and test and trace. Is it required? Are you legally responsible to report it to us? I'm not certain. I don't know, but we are certainly asking you to let us know so that we can have the greatest amount of transparency and of course, safety. All right, Mr. Hoffman, I'm gonna just do a few more slides and then we'll stop again, okay?
Sounds good.
All right. So I just wanna talk about how to submit COVID testing if you choose to do so. And you can submit for COVID testing in schools in two different ways, okay? It's very easy. The way that we're actually advocating is the signed paper consent. And this, they have updated, talk about changing, right? The consent form, it is a new consent form. So while if you have previously submitted a consent or you have previously done the consent online, it still holds. But what we are asking is for every family in grades 1 through 5 right now to print and sign the paper consent form and bring it into school on your child's first day back to the building. The printable file is available at the link on this screen. It is also available on our website in the health screening tab. I also sent it in a remind message on Sunday afternoon. The reason we're asking for the actual paper consent is on testing days, we double and triple check. When we tested in November, even some parents had done the consent online, but we didn't have a paper copy. Every parent that we had documented as consenting online, but we didn't have a paper copy, we called to make sure. We called every family, because the last call I want to get is from a parent saying, you know, my child was tested, but I never gave consent. So we double checked and triple checked by making phone calls. What having the paper copies in front of us will save us some time, especially because testing is now going to be done weekly. So when they come to school, it will also allow us on the papers to mark which students have already undergone testing, right? If they happen to come 2 weeks on the same cohort day, I don't want us to have the same students get tested each time. And so having the paper copies will help us. So what we are asking is for all families to print and sign a paper consent form for our files, okay? But the other way that you can submit consent is on your My Student account. And on your My Student account, you log in, you click your child's name, manage account, and there's a drop-down menu that appears, and you click consent forms, and you can actually give consent right there. The reason that we were calling every single family who we only had electronic consent form from is that some parents had told us they didn't maybe realize they had given consent online. So once again, by having that paper copy in our files will assure me as the person ultimately in charge that I am only allowing students to be tested who have consent. Now, of course, you might say, well, of course you have to give consent to be back in the building. I am double checking and triple checking everything when it comes to this. So once again, we are asking for you to print and sign a consent form. If your child does come to school for their first day and we don't have the paper copy, we will reach out to you. We will send home a paper copy, and you'll have to bring it the next time they come to school in order to be able to stay in school. If you don't submit consent, right, what happens? If you don't submit consent, and this is taken directly from DOE, again, you must submit consent by the day your child returns, okay? If your child comes to school on their first day and we don't have consent, we will contact you that day to obtain consent. So we will either have you fill out the paper copy that day or go online and do it online and then bring the paper copy on your next day. After that kind of transition period, students without consent forms on file who do not have an exemption, and I'm going to get to the exemptions in one moment, must be moved to fully remote instruction. And again, please know that this is not a school-based decision. This is an NYC DOE decision. Just a little information about exemptions. Exemptions as per, again, NYC DOE are not made at the school level. Okay, first of all, I want you to know that. They are granted in just a limited number of cases, and they really are for students who have medical or health conditions that would make it unsafe to undergo testing. So the examples that DOE is giving are facial trauma or nasal surgery, something like that. But you have to submit a form to be considered from that. The form must be signed by your physician. You have to submit medical documentation from your healthcare provider. And the link is at the bottom of this slide, schools.nyc.gov/COVID testing. And starting yesterday, you should be able to find that form there. If you are applying for an exemption for testing, the exemption has to be approved before your child can return to blended learning, okay? And again, all of that goes straight through NYC, DOE, and DOH. That is not a decision made at our school level. Okay, so all of this impacts our planning, our school, right? So yesterday we sent a survey out asking families to indicate whether or not they were inclined to consent for testing. The reason we've done that is because if we have a very large number of families or who decide not to give consent, it's going to shift our numbers in who's in blended learning and who's in fully remote learning. So far, when we checked the survey earlier today, there were, I think, Mr. Hoffman, about 150 responses.
Yes, about 150, but now we're up to almost 200.
Okay. And this morning, out of 150, all but 6 indicated they would consent to testing. Has that changed very much, Mr. Hoffman?
Not much, it just went up maybe 2.
Okay. So all of the families who are indicating that they will not consent to testing, we reached out to them today and we just asked them to watch this session. Or if not live, on our website later, to just see if they, just to get all of their information. That survey was just an in-house survey. That is not consent. That survey was just for us to start planning. But so far, the results of the survey are showing us that most families are going to consent to testing, which means our in-person or blended learning cohorts will most likely stay about where they were, which means that right now, currently enrolled in our school building are 643 students. After the November opt-in, when families had the opportunity to opt back into blended learning, we only have 40 students school-wide, pre-K through grade 8, who remain in cohort D by choice. That's the fully remote learning. So what that means is most of our students are coming to school. That's great, and it's not great. It's great because we love to see the students in school. The reason I say it's not great, but of course it is great, is that the number of students coming to school is so large that with the social distancing guidelines that are currently in effect, right now we have to stay in that ABC model in grades 1 through 8. Pre-K and K are on the AB model. However, I know many of you heard the mayor over the weekend talking about schools phasing out, were his words, phasing out hybrid learning. Unfortunately, sometimes statements are made in the press and they aren't fully explained, right? And what I have been told as the principal is right now, we have to remain in our blended model because of the number of students coming to our school in blended learning. Some schools, in fact, most schools, and Superintendent Amber, our superintendent, always remarks to me that 114 is the exception in the district. We have the most number of students attending school than any other school in our district. Most other schools have the predominance, 50%, some much more, students in full remote instruction by choice. But what that means is that right now, until and unless they update the social distancing capacity, we have to stay in this ABC model for grades 1 through 8. I am constantly asking, constantly hounding the space planning department to work with us. And please know that depending on how everything goes with consent, not consent, we are continuing to review our numbers. I'm also seeking guidance about additional funding to perhaps hire some substitute teachers. We have a couple of contacts of teachers who are graduating in January from different schools that we have had student teachers from who may be able to come in. It's something that we are constantly working on, I promise you, because as I've told you before, the thing that keeps me awake the most at night is the fact of how little our children get to come to school. So we are working on We did update the December in-person calendars. They are on our website. Just a couple of little changes were made to even out the number of days students were in school. We have not put 2021 calendars up yet because we are hoping perhaps that we might be able to consider some type of model change, but we will have those up as soon as possible. I just want to end quickly before I check for any other questions, that this is a caregiver decision, signing consent or not. It's your decision for sure. I just want you to know from us that we feel comfortable with the testing. We want to reassure you that we promise to maintain a safe and reassuring environment during all testing sessions. We would never, ever move forward with testing with a child who is upset, ever. You know, we are caring people, and we just want you to know that. And we will continue, as we did the one day that we had testing in the building, to directly supervise and monitor the testing for all students. Before I stop for questions, I just want to remind everybody, as we do return to the building, the daily health screening is essential. And I don't want anybody to take it lightly, because the questions in the daily health screening that every staff member and every student has to complete daily, every day, will really help to keep our building very safe. And so when you fill out the daily health screening, I'm asking you to read the questions carefully every day and answer them honestly, and then contact us if there are no's to any of these questions. So again, we're looking for symptoms in ourselves or our children. That's the first question. Of course, we're looking for positive test results. That's the second question. The third question is a very important one, and that's contact, right? So if you have been in close contact, which is defined by within 6 feet for greater than 10 minutes, with anyone who tested positive or had symptoms, then the answer is no there. No further screening is needed. You may not enter the building. And that's when you would call us. And it's very hard for us to say what the answer to that is because every single situation is different. We don't always have to call the situation room. Sometimes we can determine just in-house, but we just ask you to be transparent with us and let us know as much as possible. And the last question is about traveling. If you've been traveling internationally or from a state with widespread transmission. So these questions on the daily health screening are really what are going to let us keep our building open and safe. All right, I'm going to just put our emails up there for everybody to see, while I'm going to ask Mr. Hoffman to just look at the chat one more time to see if there are any questions that have not been answered yet.
We do have a few questions, Ms. Wilson.
I'm ready when you are.
Okay. Who are the results being shared with other than the parent and the school?
As far as I know, the results only go to the parents. I did not get, and to the staff members who are tested. When I got tested, I got my results in an email. Parents are getting their results on their My Students accounts. As far as I know, it only goes to the parents. Of course, DOH and DOE have it because the testing is run through them, but I don't know who else it would be shared with, other than if there is a positive case, it does go to Test and Trace. And then you would be contacted. So other than that, I am not sure if that, I hope that has answered your question. I do not get the results from the students. They go directly to the parents, but I imagine the day we had testing, we did not have any positive results. I imagine if there had been a positive result, I would have been well, not I imagine, I know because it's happened in other schools, the principal would be contacted to let them know there was a positive case. But aside from NYC, DOE, and DOH, and the testing and tracing within that organization, I don't know if it's shared with anyone else.
Okay. Will the parents be notified the day of if their child is randomly selected for testing?
So the way it happened in the past is the day of testing. In the past, they would let me know a couple days before, but that was when it was monthly. I don't know if that's going to change now that they're telling us it's going to be weekly. They're going to have to let me know somewhat in advance because I have to get the gym ready or the space ready. But any child who was tested in school went home with a letter to give to their parents that essentially stated that they had undergone testing that day and how they were going to get their results. So if your child is tested in school, you will get a letter as when the child comes home. As much information as I have, I will share. In the past, they have asked us not to share the exact date. They've asked us to share that we would be having testing sometime in the next couple of days. But I will let you know, again, I have to follow the guidance from DOE, but I will let you know when I'm notified. I'll let you know that we've been scheduled for testing this week.
Okay. What will the protocol be if we sign consent, parent signs consent, and the child is afraid and asks for a parent to be called?
If the child is afraid or shows us that they're fearful or they're nervous, we will not have them undergo testing that day. I say this in hopes that not every parent sends their children and we don't have the whole school saying that, right? Then we'd have to revisit that. We would take it on a case-by-case basis. So like, for example, if a child, I'm just going to use the name, Jonathan. If Jonathan is pulled for testing and he shows us that he's nervous and he's asking for mom or dad, and he's nervous, we're not going to go through with it. If it happened again, let's say Jonathan got called for testing a second time and a couple weeks later or 3 weeks later and it happened again, we might call mom or dad and we might have a conversation. We might do what we could to make Jonathan feel comfortable. But I promise you, I am not, Ms. Fulchetti, Mr. Hoffman, Nurse Katie, and I are not going to make any child get tested who is feeling unsure or nervous.
Okay. If a parent does not sign the consent form at this time, are they able to opt back into blended learning at another time?
Yeah, I think so. I think we're talking about two different things here. There's the blended learning preference, which is already done. That's closed. If you're in blended learning right now, you're in blended learning unless you opt for full remote. Separate and aside from that, now is the consent for testing. So it seems to me the way that this is set up right now is if you don't sign consent right now, you would still have the option to. I have not been told otherwise.
What happens if a student cannot perform or have the test and they return to class? Will they be forced to go to remote learning?
If it's a one day, if we're having testing in the building that day and a child is called for random testing and we bring, I'm going to use the name again, Jonathan down, and he shows us that he's nervous or upset and we bring him back to class, we will go on with the day. He will not be sent for full remote instruction at that moment. Again, we'll take it on a case-by-case basis. We would, again, call the caregivers, mom, dad, whoever, is the caregiver. We'd have a conversation. We would try to, with the parent's permission, we might have him observe somebody get tested to see that it's very easy. He might watch a friend or a classmate get tested. We would try to do what we could to make the children comfortable, right? But we would never make them do anything that they were uncomfortable. If over time, if a child is called for random testing several times and they never do it, I would have to take that on a case-by-case basis because I haven't been there and this is brand new. I don't know what would happen eventually. The idea, hopefully, would be to have the child comfortable enough and the parents comfortable enough to have the testing. We're also going to have Ms. Weiss, our guidance counselor, Ms. Sullivan, our school psychologist, do some little lessons in the classrooms, just to have the children feel very comfortable. And I think from watching, if you watch the video, again, that we showed a few minutes ago, it is a very quick and non-invasive.
Okay, what percentage of positive test results would trigger another fully remote only response?
Well, all of that also is a case-by-case basis. When there are 2 or more cases within a school, Test and Trace will begin to track and trace to see if the cases are related, or if through Test and Trace they can determine where the cases came from. And so the results, depending on what Test and Trace find, will be specific to that case. So it's very hard for me to tell you. If it's one positive case in a school, it could be as little as a classroom closure. If it's 2 or more, then they start looking at different possible connections, and if they can't rule it out, they say, well, it possibly could have come from the school, so we have to shut the school down. I will say that I do feel, and this is a feeling, I will say this is in my feeling, I feel that our school is probably one of the safest places for the students to be. We are practicing social distancing. We are keeping our masks on. We are in isolated circumstances where the kids aren't walking around the building. In the school building, I really feel very safe with the students. You know, when I leave the building and I see them all together out in the playground or on 129th Street, I think that's where the transmission could possibly come. But in the school building, I do feel that it's a very, very safe place. Okay, it's 4:45. So I think we're going to, our emails are here. If there are any specific questions that you may have about the testing and going forward, please feel free to email any one of us. And we will get back to you. I will say that as of today, this is just a little number for you. We have 600 and what did I say? 603 students in our who are signed up for blended learning. And as of today, on the electronic portion, we had only 125 families who had submitted consent. That means something and it doesn't, because I'm asking everybody to actually bring the paper consent with you on your first day back. So we just want to make sure we have that. Okay, so please, again, where you can find that paper consent is on our website in the health screening tab, or in the remind message that I sent on Sunday, or in this PowerPoint. It shows you where you can find that. And we're going to put the PowerPoint and this recorded session on our website. It'll be there by early tomorrow morning, in case you want to go back and look at any of this information. Okay, thank everybody for being here. I just, I thank you once again, Ms. Falchetti, Mr. Hoffman, Nurse Katie, and I. We really do thank you for the trust that you put in us as you send your children to school in normal times. But we really appreciate, and we don't take lightly, the trust that you put in us in these very uncertain times. So with that said, I hope everybody has a wonderful evening. And we are very excited at the prospect of having kids back in the building on Monday. Okay, good night, everyone.
Thank you.
Good night.